In today's Health Alert, a new study suggests government food policies may help reduce childhood obesity rates. Researchers in Chile saw measurable changes after the country introduced warning labels and restricted sales and marketing to school-aged children. Our chief health editor, Dr. Partha Nandi, joins us now. And Doc, how much did these food policies help?
Yeah, pretty interesting study. I like this. So researchers studied more than 300,000 children between the ages of 4 and 6 in Chile, and the country introduced a law recently requiring foods and drinks high in sugar, saturated fat, salt, or calories to carry a warning label in front of the package, not in the back. It also restricted sales in schools and banned marketing aimed at children. So how much of an effect did this have, right? So researchers found meaningful improvements in the first 18 months after the law was introduced in 2016. Girls had a 2.9% lower risk of being overweight or obese, and boys had about a 2.4% lower risk. That may not sound like much, but even small reductions in excess weight during childhood can make a huge difference later on in life, and that's because childhood obesity is linked to a higher risk of type 2 diabetes, high blood pressure, heart disease, and continued obesity into adulthood. And adults with obesity are also at risk for stroke, many types of cancer, and early death. So, I think it's helpful.
So how does the U.S. compare when it comes to overweight children, and could a policy like this help us?
Yeah, we're not doing great. So right now, about 1 in 5 American children and teens have obesity rates, and they're higher amongst teens, Hispanic and Black children, and children living in lower income households. So as for whether the U.S. would benefit, right, from these similar policies, the Chile study shows us that it's not just about personal choice, but it's also the environment that our kids grow up in, the foods marketed to them, and what's available in schools, and how easy or hard it is to make healthy choices. So in my opinion, policies like clearer food labeling and limits on junk food marketing to kids could help support healthier choices. That said, childhood obesity is influenced by a lot of factors, not just diet, but also genetics, eating habits, physical activity, sleep, and access to healthcare all play a role. So, I think it's an interesting way to looking at it. I was in Mexico and I saw they had some labeling as well. It really affects you when it's right up front and center in your face, and you have to make those choices.
Yeah, you see it and can believe it.
And as parents, you can advise your kids and make some choices.
All right, Doc. Thank you so much.
Of course, my pleasure.
If you have a health question for the good doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or X. We'll get it right to him.